morning everyone. My name is Fatimah Zaharah and I'm your pharmacist for today. So today I'll be talking about amlodipine medication. So the most important part when you're taking amlodipine is you need to tell your doctor or your prescriber if you are having any liver disease or congestive heart failure disease. So the next one will be if you're taking amlodipine and also you consume alcohol, you should know that the alcohol will subsequently reduce your blood pressure, but at the same time will increase the side effect of amlodipine. The last one is you need to know that you might need to take this amlodipine medication throughout your life. So it is important to know that you also need to take this medication even though if you are feeling better. So the next one I'll be talking about common side effect when you are taking amlodipine. So the first one will be some swelling in the legs can be observed. So if this condition persists or the swelling are getting severe, you shall need to see your pharmacist or your doctor back for some adjustment of the dose of your amlodipine. So the next one will be lightheadedness and also headache. So basically, lightheadedness and headache is common for all antihypertensive medication. The last one will be erectile dysfunction. Might happen to male patients who are taking amlodipine. So there are some contraindication for this medication. The first one will be for the patient who are having hypersensitivity to amlodipine. The next one will be the symptomatic hypotension. The third one will be persistent dermatologic reaction, and the last one will be congestive heart failure. So when you are taking amlodipine, if you miss a dose, you need to take the missed dose as soon as you remember the dose. And the second one, you cannot double the dose because if the dose that you are missed is closer to next one, just take the next dose and don't double the dose. So that's all for my explanation for amlodipine. Thank you.
Greetings, my name is Elfineigo and I'm your pharmacist for today. So now, I'll be talking about a drug called amlodipine. It is usually used for treatment of hypertension. It is also known as an antihypertensive drug where for the treatment of hypertension, it may be used alone or in combination with other antihypertensive agents. It is a calcium channel blocker where it inhibits the calcium ions from entering the slow channels of vascular smooth muscle and also the heart muscles, also known as myocardium. It is taken orally with 5 mg once daily or 2.5 mg once daily for small or frail patient, and it can be taken without regards to meals, but it is advised to be taken after meal. For pregnant women, it is advisable to not consume amlodipine. The availability of dosage forms of amlodipine is 2.5 mg, 5 mg, and 10 mg tablet. So, what patient can expect after consuming this drug is that for patients 60 years old and above, the goal of therapy is 150/90 mm mercury. For patients 60 years old and below, the goal of therapy is 140/90 mmHg. Also, the common side effects of amlodipine is hypotension. Symptomatic hypotension can occur. Acute hypotension upon initiation is unlikely due to the gradual onset of action. Blood pressure must be lowered at a rate appropriate for the patient's clinical condition. Secondly, the most common side effect is peripheral edema, and it occurs 2 to 3 weeks of starting therapy. This tablet should be stored in a cool, dry place or at least in a room temperature. Thank you and have a nice day.